I'm Dr. Lauri Grossman, and I practice homeopathy. Homeopathy is a complete system of medicine that uses the symptoms that people are experiencing as guides for the natural remedy that can help restore balance in their body the most. One of the most useful avenues for homeopathy is when these low-dose natural medicines can address ailments for which conventional medicine has yet to find a cure, or even something that can alleviate symptoms. We've had some wonderful results with homeopathy in dealing with autistic children. I don't think there's anybody that would say homeopathy is a cure for autism. Amy Lansky, in her fabulous book, Impossible Cure, goes into detail about how homeopathy has been used to help children who are on the autistic spectrum. In a similar way, homeopathy is used to help women as they go through menopause and different sorts of female disorders for which conventional medicine really just has nothing. And instead of people suffering for years and years with complaints, homeopathy really does offer a wonderful option to many people for which there aren't others. I think of some of the most common things that people do come to my practice for. I think right off the top of my head, I mentioned children with autism. I mentioned women with different hormonal or female disorders. But people with chronic headaches, that's another very big part of my practice. And then people with emotional problems. I would say that homeopathy can be quite effective for anxiety, for depression, for insomnia, for restlessness. And of course, the list goes on and on. I think as we move into the later parts of the 21st century, I think we've already acknowledged that an integrative approach is the best approach. But what we're now beginning to discover is that everybody's different, and for different parts of people's lifetimes they're different, and for different ailments they're different. And I think the medicine of the future will be able to draw in the modalities or the therapies that help people the most at that time. So there will be times where a conventional medical drug is your optimum, choice at the time. And there will be other times where homeopathy is really the thing to go for, or maybe it's acupuncture. And as different practitioners become more familiar with the other options, we'll be much better able to draw in partners to work with us. To say, you know what, I've been working with you for this ailment, but right now, actually, I'm not the person for you to see. I'd also like for you to see the GI specialist, or I'd also like for you to see the acupuncturist. And that's when we really hit the nail on the head, when we know that we can all work together to provide optimal care for people. In many traditional hospitals, the physicians, the residents, they want to know more. Years ago, there was an iron wall between conventional medicine and the various integrative approaches. Even in that time, we didn't even call it integrative, we called it alternative, and you had to make a choice, this or that. And you couldn't even mention to one side that you were seeing the other side, or they'd drop you as a patient. And those days are really over. I think everybody will acknowledge that working together works best. And so it's a joy to go into hospitals and to work with physicians and nurses and physical therapists and occupational therapists who've been in practice for a long time, because they know where their specialties fall short of the mark. They know, based on experience, based on years of practice, where they could use a boost. And if everybody's being honest with each other, then we know where we can work together to give our patients, the best results.